Let's discuss the Stanford and the Bakey classification. The Stanford and the Bakey classification is used to classify aortic dissection. What is aortic dissection? The aortic dissection is a transverse tear in intima of a vessel that result in blood entering the media, creating a false lumen, leading to a hematoma that propagate longitudinally. If we look at this diagram, in a normal vessel, there are three layers: the inner intima, middle media, and the outer adventitia. In aortic dissection, there is a tear of this intimal layer. As a result of this tear, the blood will accumulate in media, creating a hematoma which will propagate longitudinally. To classify this aortic dissection, we use two classification criteria. The first one is a Stanford and the second one is a Bakey classification. Both of these criteria depend on the location of aortic dissection. So let's discuss the Stanford classification first, and after that we will study the Bakey's classification. In Stanford classification, the aortic dissection is classified into two types, type A and type B. In type A aortic dissection, there is an involvement of ascending aorta. If you look at this diagram, this area represents the ascending aorta. If there is aortic dissection here, it is called as Stanford type A. It is the most common type of aortic dissection and involves 2/3 of our cases. In Stanford type B, there is an involvement of aorta distal to the left subclavian artery. If you look at this diagram, this area, the area below the left subclavian artery, if this descending aorta is involved, it is called as a Stanford type B. It is about 1/3 of our cases are of aortic dissection present with Stanford type B. It was all about the Stanford classification. Now come toward the Bakey classification. In the Bakey classification, the aortic dissection is divided into three types: type 1, type 2, and the type 3. In the Bakey type 1, the aortic dissection originates in the ascending aorta, but it can propagate to aortic arch and possibly beyond it distally. If you look at this diagram, here the aortic dissection is an ascending aorta, but it can spread to the arch of aorta and beyond the arch of aorta. It is called as Bakey type 1. In Bakey type 2, it is originated and confined to the ascending aorta. If you look at this diagram, the aortic dissection is an ascending aorta and it will not extend beyond the ascending aorta. It is called as a Bakey's type 2. In Bakey's type 3, there is an involvement of descending aorta. If we look at this diagram, the area which is distal to the left subclavian artery, if this area is involved, it is called as Bakey's type 3. In Bakey's type 3, the aortic dissection may extend proximally, may involve the arch of aorta, but most commonly it extends distally, but it will never involve the ascending aorta. It was all about the Stanford and the Bakey's criteria. Now a question arises that what is the significance of classification of aortic dissection? We classify aortic dissection because different classification have different treatment option. For example, in Stanford type A, the aortic dissection which involve the ascending aorta requires surgical management because it can spread to the heart and can cause rupture and cardiac tamponade, which is fatal. Therefore, in Stanford type A, the ideal treatment option is surgical, but first we have to decrease the blood pressure to 100 by 120 mm of Hg. While in a Stanford type B, the treatment approach is conservative. We advise a patient bed rest and we will reduce the blood pressure with IV labetalol to prevent the progression of aortic dissection. So it was all about the Bakey's and Stanford classification. If there is still any question, you guys can ask and stay tuned for more update.